Have you ever learned something that has changed your opinion completely? I recently acquired information that will change the way I care for my family forever. I learned the alarming fact that the misuse of antibiotics is causing our medicine to be less effective. We are creating antibiotic-resistant superbugs. The Center for Disease Control, or CDC, in 2013 stated that antibiotic resistance is one of the preeminent public health concerns of the 21st century. We've all had some form of exposure to antibiotics, many of us rushing to the doctor at the first sign of illness, not knowing we could be contributing to the rise of these superbugs. Today I will describe antibiotics, antibiotic resistance, and discuss what you can do to help the problem. Though antibiotics can be misused, they have saved countless lives. Let me start by clarifying what antibiotics are and what they do. Per Simon in 2013, antibiotics are agents that either kill or inhibit the growth of bacteria. One antibiotic we all know is penicillin. This was introduced in the 1940s. It was so effective that doctors at the time predicted that it would end infections forever. We now know this was not true. Though beneficial, antibiotics do have limitations. That original form of penicillin is virtually useless today. The bacteria have mutated over time and become resistant. Another limitation of antibiotics is they don't affect viruses or viral infections. So cold, flu, and stomach viruses cannot be treated with antibiotics. According to Murray, in 2009, most sore throats and many ear infections are viral and should not be treated with antibiotics. Now that you understand a little bit about the subject, I will explain how once treatable bacteria are becoming resistant superbugs. According to Calgatti in 2013, antibiotic resistance occurs when bacteria become completely or partially immune to drugs previously effective at killing them. The drugs are developed to fight the bacteria. Bacteria then mutate. The drugs are modified, and then bacteria mutate again. This is a dangerous cycle. Per Murray in 2009, each year in the U.S. alone, 2 million people become infected with resistant bacteria. 23,000 die as a direct result of these infections. The most well-known superbug is MRSA, which can create a form of staph infection. MRSA is prevalent in hospitals and nursing homes, but is also becoming an issue in sports that share equipment like football, gymnastics, and wrestling. As patients, we are exacerbating these issues with our misuse. According to the CDC in 2013, patient overuse is the #1 cause of antibiotic resistance. Overuse is when we take antibiotics too often or when they're not actually needed. This gives bacteria extra exposure to the drugs and allows the bacteria to mutate. Another improper use of antibiotics is not finishing prescribed doses. This allows the strongest of the bacteria to survive and reproduce. These superbugs are scary and should motivate us to action. So what are some ways that you can affect change? First is gain knowledge on the issue. Research for yourself and develop your own opinions. You can also express concern to your doctor. An important step is to spread this knowledge as well. Inform your friends and family and help them understand the dangers of misusing these drugs. You can also take responsibility for the proper use of these drugs yourself. Don't pressure doctors to prescribe drugs when they're not needed. Ask for medications that treat the symptoms, such as fever, cough, and pain relievers. Also, finish all prescribed antibiotics. Don't stop when the symptoms go away. If the bacteria are not completely eliminated, the infection may return and be much harder to treat. As I end this presentation, you hopefully know more about the use of these amazing drugs. We have learned about antibiotics, the issues that resistance causes, and what we can do to help affect change. I hope this frightening yet important information has the same effect on you. As I mentioned, it will change the way I care for my family.